Hi, I'm Dr. Elizabeth Baus at Integrated Health Solutions, and today I'm going to go over why we're called Integrated Health Solutions. So we're called this because we have an integrated approach. So what I mean when I say that is we are integrating 4 different types of therapies together to get a better and a longer lasting outcome for our clients and our patients. Those 4 specific things that we add together, one of which is dry needling, which we do with TENS often, one of which is soft tissue, which we do by hand or using instrument assisted. All 6 docs are chiropractors, so that is also one of the therapies. And then the 4th one is functional rehabilitation. And our functional rehabilitation is based on the developmental positions of a baby and like looking at how a patient is moving and how that's changing, what they're activating, and maybe causing problems when you have something small but you do it wrong, but you do it 100,000 times. So visits here are with the doctor, so the doctor's doing all 4 of these therapies, and they're about 40 minutes long. And we usually start with the soft tissue and the dry needling first and get everything as relaxed and as activated as it can be, depending on which way it needs to go. And then it's easier to tell what needs to be adjusted because we're just looking at what's restricted and not moving. So we do the adjustment after the dry needling and the soft tissue work. And at that point, you're probably the best you're gonna be that day. Everything's as relaxed as it can be and you're adjusted so you're moving as well as you can. And then we practice the exercises together. And you get time in between that and the next visit to work on it at home. We're really pro giving you as much as we can to do at home so you can help yourself, especially if it's like on a weekend or something. And then at your next visit, we check that exercise to see if it's good. And if it's a good one, then we move on to the next progression. And in that way, we get you closer to fully functional movement, at which point you're released from care. Research is really clear that putting all these things together works better than any one of them in isolation. And we love having great results and long-lasting results for our patients. So if you have a musculoskeletal issue, make sure you're getting all of these points addressed, whether it's through one provider or sometimes it takes several. But at IHS, we have it all under one roof.